Okay, Chapter 32, Section 5. Yellow fever, dengue fever, chikungunya, and Zika. Thing to keep in mind, yellow fever, dengue fever, chikungunya, and Zika, these are all going to be mosquito viruses spread by mosquitoes. We generally don't see these. These are not endemic here to North America, US, Canada. But you will see these in a medical setting here in the US and in Canada due to the fact that, well, we like to travel and vacation in Latin America, South America, Africa, Asia. You hop on a plane and in 12 to 24 hours, you could be anywhere in the world. Hop on that plane again and you're back in 12 to 24 hours. You can go pick up something, get bit, and be home before the first symptoms ever appear. So the first one, yellow fever, caused by what we call the yellow fever virus. All right, we didn't really, go out on a limb on that one. It's related to the dengue viruses and whatnot in the West Nile because it is an encephalitis virus. Encephalitis. Remember, anything is an itis means inflammation of encephalies. Okay? Encephalies. That means the brain. This had meningitis, that would be the meninges. But this is encephalitis. So this is the actual brain and spinal cord itself will begin to swell. You'll have inflammation of, because the virus is infecting the brain and whatnot. Mosquito bite. As I said in the last section, what happens here is the mosquito goes in, jams its proboscis through the epidermis looking for the underlying capillary beds. It finds them. The first thing it's going to do is it's going to spit out saliva, and that saliva will be anticoagulating proteins, compounds to keep the platelets and whatnot from clotting. So it can keep the blood flowing, keep that blood meal. That's usually what causes the itch. Well, when it spits out that saliva, along with that saliva is going virus particles. So it's now gone from inside the mosquito into you. It's endemic in tropical and subtropical climates of Latin America and Africa. No antiviral drugs right now, but we have a pretty good vaccine going. So if you're doing any traveling, this is going to be one of those shots they're going to want to give you. Here's your yellow fever shot. One of the things they're doing in certain areas that yellow fever is endemic, they're also going around and spraying, trying to kill off the mosquitoes, keep the mosquito populations in check, so that way they can reduce the number of vectors. No mosquitoes, no way for it to get these spread person to person. So you look, it goes in for a bite, it spits out saliva, and that saliva, it's carrying the RNA virus that we know as the yellow fever virus, which they're showing right here. Dengue fever, yellow fever, it's spread in the saliva. The dengue fever, caused by the dengue virus, I know, not a big stretch there. It's the most common vector-borne disease in humans. Endemic again, certain areas, Mexico, Latin America, South America, India, Indonesia, Africa. Not the US. How do we see it here? You travel there. You spend a day or so there. You're gonna get bit by a mosquito there. The dengue fever, most people improve on their own, which is pretty good because there's no antivirals. Patient presents in the ER, or shows up in the ER, presents with, dengue fever. Basically, you're going to give them supportive care. You're going to give them, IV fluids to keep keep them hydrated. You're going to give them different drugs to make them feel okay, but you're just going to let it run its course. Zika is the new one. This is an emerging one. Basically, about 7 years ago is really when this hit the news. Appeared in Brazil, started spreading throughout South America. This is one that spread person to person via the mosquito bite. But what really freaks us out about this one is mom gets infected. Zika can cross the placenta. Crosses the placenta depends on when in gestation, what trimester is the baby in. Early in, first trimester, early second trimester, as the baby is developing. If it crosses then, it can lead to severe neurological problems. Basically, what you see is what's called microcephaly. The head, the brain do not develop correctly. So the rest of the body will be the right size, the right shape, but the brain, the head will be greatly reduced, come out all literally about half the size that it should. There's no, they'll grow out of it, or they'll do, no, that's basically the way it is, which is why it freaks us out. If you're an adult and you get, headache, fever, general malaise, you kind of feel almost flu-y-like, but no vomiting, things like that you would normally associate with the flu. And it'll clear up on its own. It's this right here is what freaks us out. It crossing the placenta.